living in an increasingly polarized world.
My administration has accomplished more than almost any administration.
We must begin now.
Welcome to the Bulletin podcast.
Hello and welcome to the latest episode of the Willie Brandt School Bulletin podcast. We are your co-hosts today. I am Alyssa.
And I'm Ari. We are both the first year students here at Willie Brandt School, and we are excited to bring you the latest Bulletin podcast episode. So, what's the topic of today's episode, Alyssa? I'm so excited that we're finally having our first new podcast.
I know it is exciting today that we're getting our first podcast, so let's get cracking. Today we will be discussing vaccine hesitancy with Dr Gbadebo Collins Adeyanju, who has been doing some research into this matter. Collins has worked for international development organisations here in Germany as well as in Nigeria, but is now a postdoctoral researcher and lecturer here at the University of Erfurt, specialising in public health and vaccine hesitancy.
Hi, and welcome, Collins. Thanks for giving us some of your time today. How are you?
I'm very fine. Thank you for having me. I'm excited to be here to share some views on the subject matter, and I hope we have a nice time today.
Great to hear that. So we've read some of your publication about the growing hesitancy on vaccination, and it's been highlighted that in some countries around the world, vaccination rates are in fact decreasing. And the World Health Organization in 2019 identified vaccine hesitation as one of the top 10 global health threats. To give some backgrounds to the listener today, would you like to share about why you think we are seeing this trend right now?
There are several reasons why we have growing rate of decline in vaccine acceptance, or what we refer to as a vaccine hesitancy. Of course, to contextualize this in proper picture for listeners and everyone out there, we have come to understand that vaccination is one of the 20th and 21st century medical miracle, and it's actually referred to as one of the most successful medical breakthrough, and that has been touted as the multifaceted approach for addressing community and population, especially population ravage with diseases that are preventable. And in the last 30 years and 40 years thereabout, this has been very, very successful in many contexts and also in many settings. But since recently, we have seen that this success have been gradually eroding and declining. And also, it is no gainsaying that to ensure a healthy society and to prevent the outbreak of vaccine-preventable diseases, the uptake of vaccination needs to be at a very high rate in order to have a herd immunity. That means significant proportion of the population are protected, or significant proportion of the population are protecting very small amount of people who are not vaccinated. So in a more broader sense, it is a way of preventing infection, and more importantly also for vulnerable groups, children, women, and also those with immunodeficiency individual within the society. Why this has been declining in recent time has been due to a lot of factors, and some of the factors have been researched. I have been working quite a bit on a number of them, but also to talk about why and these factors that have been contributing to this problem. It's also important for everyone out there to also understand that just get some figures out there of what vaccination does as well. It's also important to note that vaccination averts more than 14 million deaths annually, and over 250 million disability adjusted lives are prevented as a result of vaccination. It also generates more than $200 billion in terms of economic benefit. And most importantly, which is also very primary and very dear to my heart, is that it also prevents between 2 to 3 million deaths of children yearly. So, without going, of course, I wanted to go straight to why do we have increasing number of hesitant behavior towards vaccination. But it's also important for us to understand the magnitude of what it does before we begin to now dig into what are the reasons and what are the issues surrounding why we are having a declining acceptance or declining uptake of vaccination. So these are also, very, very important. But despite these numbers and these figures, in the last couple of years, 5, 10 years, we have seen a declining trend, just like I said. Despite all of this, 1 in 5 children are still yet to be vaccinated, either unvaccinated or partially vaccinated. And this is contributing to more than 1.5 million deaths annually of vaccine preventable diseases among children. And for this, it is even more it is even uh, more serious in low and middle income countries, especially in sub-Saharan Africa, which I am particularly interested. My research focus is particularly interested in. So these are the reasons why, the motivation to understand why is this thing that is contributing to this beautiful positive trend globally and also in low and middle income countries. Why is it becoming a problem at this point in time? And why is this now becoming, people are becoming fearful that with this with this declining vaccine acceptance rate, the it increases the chances of vaccine preventable disease outbreak, especially in low and middle income countries and sub-Saharan Africa. And when this happens, it further compounds the already precarious healthcare situation in those countries and further plunge this population into more serious battles. More also to also notice also, it draws back the successes that have been achieved in these places way, way, way back. So I think as we move along, I will provide some more context specific factors as to why we think these are the reasons why we're having this low trend, but just to put some title on them. We have, based on the studies that have done in the sub-Saharan Africa region, we have seen issues of vaccine confidence as a factor. We have seen issue of masculinity, which is the attitude of fathers. Of course, talking about attitude of fathers, we're talking about decision-making capability within a household, resting more on the father than on the mother, and thereby the attitude of men or the father of the child influencing to a large extent either the child is vaccinated or not vaccinated, because we have seen several studies looked at it and see that men or fathers who have negative attitude towards vaccination have lower vaccination uptake among their children. Also, we have religious and cultural factors as also contributing issues. And lastly, we have issues that borders on misinformation and rumor as associated, broad theme that we have looked at in these situations. But I'm sure as we go ahead, we might dig deep into some of this.
Yeah, I think we're on the same wavelength there, Collins, because I was just thinking about how does vaccine hesitancy change from community to community, country to country, and does gender in particular, what does that have to play in how people think about vaccines?
Yeah, I think from communities to in the context of definition of vaccine hesitancy in itself, we have also seen that, and the research that have been done over time have also shown that hesitancy actually, it's not a broad, it is not one blanket for all. It is context specific in most times, and sometimes even vaccine specific. There are specific vaccines that people are even more hesitant, or population are more hesitant to against other ones. We also discover that also it could also be generational, as in between certain age bracket groups and the other. Also time, depend on the time that and we have seen. And like you have mentioned just now, community to communities and even gender. I will come down to gender issue much later. But in terms of community to community and place to place, there has been a lot of understanding or evidence that have shown that um, the drivers in one community may be different from the driver in other communities. But certain factors have also come on or bring or brought all this together under one fold, especially when we are looking at it in the context of sub-Saharan Africa, for example. Many of the factors are similar. Yes, the dynamics and the approach and the evidence surrounding the actions and the decisions may differ in a bit of context, but they are a lot more a lot more similar. But also another that have also been seen based on the study that I have done in Nigeria particularly has also shown that it could also be different among the same person with at different stages of life. Especially a study that I did recently about vaccination decision making, and looking at pregnant women. The same pregnant women are looking at the same individual pre-birth and post-birth, and the study shows that the factors guiding decision making for vaccination pre-birth is actually different from the factors guiding the same person using the same indicators, using the same framework to assess the person, and shows that different. So intention to vaccinate and vaccination behavior seems to not be on the same page in this case. Of course, our several theories that have looked at it from a theory of planned behavior, looked at it in terms of how subjective norm and other factors influences intention, and intention influences behavior. But in this context, we've seen that even within the same individual, there can be different kinds of decisions depending on this different scenario. One assumption could be that during pregnancy, the severity of the decision is not as serious as when you have your child in your hand and you want to protect the child at all costs, and you are more critical and analytical in terms of what you put in his or her body. And those are maybe some kind of issues surrounding that. But I think more research still needs to be put into understanding why the same individual at different stages of this process making two different decisions. And I think that will be similar to what you find in community to community. We also discovered that in among religious groups, the Christian community and Muslim community have different approach and different perception towards vaccination. In Nigeria, in Malawi, in Nigeria, for example, those from Islamic community are less likely to vaccinate the children compared to those from Christian community, and those from the northern part of Nigeria have lower vaccination intention compared to those from the southern part of the country. The same also compared to Malawi. Even within this Christian community, different sects within the Christian community have different perception towards vaccination. So there are no monolithic or monographic way of understanding or explaining some of these, but there are also different contexts in which one can understand them. But the measurement of the process for making decision could be the same, could be contextualized into certain theoretical framework, which some of them can be found in some of the publications that I've done in these areas. So it is interesting to see that groups make make certain decisions based on different factors, and sometimes also based on similar factors. But across this region, especially for sub-Saharan Africa region, and by implication low and middle income countries, we find that there are this broad thing that I've discussed at the beginning of our program as some of the thematic drivers of vaccination behavior are very indicative of how vaccination behavior evolve and changes now and over time.
Okay. Well, looking at those factors like a very complicated, and there's a lot of factors that taken into when it comes to this matter. And what do you think that we've seen a lot of governments put resources into health literacy programs in an effort to increase vaccination rates? And do you think that is this already effective? And what are some of other policies governments are implementing to tackle the issue of vaccine hesitation?
Yeah, thank you very much for this very question, because it's a very popular question. Because the outcome of every research is to see, okay, what can we do? How can we better the situation? Which is also unique to what I also like to do in my research. It's not just producing evidence and throw it out there for academic consumption, but also how can we translate this evidence to actual policies? How can we use this evidence to improve the condition of what we have at the moment. And it is important to also conclude some of these with those aspect that deals with not necessarily recommendation, but in the discussion section of those academic production, what can be done about this situation. And I think that several approach has been developed, whether by WHO in collaboration with some other international organizations that are handling or that are invested in public health intervention in low and middle income countries. Some of the ones that we have seen that have been that have had some kind of positive outcome have been those that are associated with uh, um, uh, decisions that are made not out of unilateral government ability to impose or to change behavior unilaterally, but as a result of consensus building among stakeholders, WHO, local partners, international partners, and also the community themselves, framing of some of these things. I think some of them that we have seen that have had significant result have been, one of them is issuance of certificate, immunization certificate, have psychologically been very helpful in, not only in giving confidence to the parents that I have gone through a process to ensure the health of my child, and I have completed the dosages and the doses for this child for various vaccines, and I have evidence to show that I have done this. Psychologically, it has an empowering ability, and also it helps the woman, the parent, to have this sense of sacrifice for my child, irrespective of all that I've gone through, that I've been able to achieve a certificate that shows that my child have taken all this, and the child could be healthy. There is also another one that we have seen to also have significant impact, and that is um, uh, demanding immunization certificate for enrollments for school enrollment for children. That has also had significant, especially in the sub-Saharan Africa region, where the demand for vaccination has been declining over time. Mandatory presentation of vaccination certificates as is mandatory during child enrollment has shown good efficacy. Another one that has also been very helpful is the idea of incentivizing caregivers during immunization days. Of course, in some countries, there are specific days that are earmarked where parents go to hospitals and get their immunization done. And the idea is also to build a community around those kind of decisions. And when you see a cluster of people coming to make the same decision, you are further your the reasons for making the decision to vaccination is further reinforced by the community that you see built around it, and that has been very helpful. So giving lunch or providing breakfast or lunch during those immunization meetings or immunization appointment has also been very helpful in providing less distraction for the caregivers, where they don't have to go and worry about breakfast for their children or themselves, and or lunch or whatever for that. So that has also been very helpful in helping uptake of vaccination. Another one has also been reducing the amount of time spent at the clinic for immunization appointment. That has been considered one of the factors influencing convenience. There's a psychological construct that has been part of the framework developed by our Cornelia Birch here at the University of Effort, talking about the 5C for understanding vaccination decision making, the constraint aspect. And some caregivers have said that, of course, they have different priorities, they have jobs that they have to leave to go to vaccination appointments. And if you have to go to vaccination appointment, it shouldn't take the whole day, or it shouldn't take hours, it shouldn't be so lengthy. So the idea of intervening or developing policy around the waiting time or waiting hours for immunization appointment, that's reducing it, has been very helpful in providing that so-called, and also lessening the the stress that caregivers go through when immunization. And another, the last one I will mention also is providing, devising a very smart strategy of targeting households that are very nomadic. That are very nomadic especially in sub-Saharan Africa. There are populations that are very nomadic, and they move from one particular location to another location, and they are likely to take the first dose of, for example, a yellow fever vaccine and not take the second because they have moved from where they were initially. So the idea of devising a mobile immunization campaign for those kind of group has also been very, very effective. So policies like that have a way of ensuring that hard to reach places or hard to reach communities or very mobile communities as well are not left out in the vaccination campaign in general. So irrespective of how mobile you are, irrespective of how far away you are from the nearest clinic or public health facility, you are still able to be reached with this mobile clinic that campaigns. So that has been very good in terms of policies that we have seen over time that have increasingly become good. The last one that I also mentioned, if we still have the time, is that also ensuring that more resources are provided for research on vaccine hesitancy has also been something that has been concerted effort in a policy frame by a lot of states or a lot of government that is increasingly becoming very popular now, where there are funds available for not only for understanding vaccination decision making, but also designing and proposing intervention that could help address some of these issues that surround vaccination decision making. So that in itself, or those and the funding availability have been very helpful lately in addressing some of the concerns that we have, especially relating to health literacy specifically. That is a very, very big subject. If we start health literacy today, we may not finish. But I think that just mentioning something, by the way, on health literacy, one significant aspect of successes that we've achieved previously when we were seeing the positive trend of vaccination coverage was because of the increasing permeation of health literacy within communities in the low and middle income countries, and that led to the kind of trajectory we saw when we have this beautiful statistical upward movement of vaccination coverage globally. But we have seen that some other factors have come to puncture some of these, and the content of the literacy level, especially the health literacy, needs to also be improved. I give you an example. A study that I did some time ago shows that some communities think or have the idea that vaccination prevents all diseases, right? So that has a way of, yes, they are very knowledgeable. They seem knowledgeable about vaccination. They seem to have positive attitude towards vaccination. They seem to have very good context or good concept of what the benefit of vaccination is. However, the benefit of vaccination may have been overstretched here by thinking that vaccination can prevent all diseases. And in the event that one of the diseases that they assume vaccination can prevent happen, that could set them backward in terms of the loss of confidence. So there needs to be an update in the amount of literacy that we also dish out there, and to accurately portray what is preventable by vaccine and what is not preventable by vaccine. So this is this is something that we need to improve upon.
Mm-hmm.
Thank you.
It was very interesting when you brought up the sort of role of a parent there, because well, with vaccines, there is a decision that needs to be made if you choose to take the vaccine or if you don't. So then it calls into question people that might have a parent or a guardian, somebody like that in their life that is making a decision for them. For example, you mentioned children already, potentially the elderly, some people with disabilities. So, for example, if a guardian or a parent, if they are vaccine hesitant, and they then choose not to have their child, their elderly parent, or their family member, maybe with a disability, not to get vaccinated, what do you think government should be doing in that space? Because that's a bit of a sensitive space where somebody is the guardian, the carer for this person. However, their decision could potentially be detrimental for the person that they're caring for. So what's your opinion on that?
Yeah, I think one aspect of it could be to look at it from parents or legal guardian making decision for an underage, right? The second aspect is a parent or legal guardian making decision for a disabled person, right? The one for the underage, especially children under 5, which I have done a lot of research on, uh, of course, in several of the studies that we have done, especially uh, among pregnant women and mothers under the mothers of children under the age of 5, it shows that uh, the, the person making the decision is of course the most important target here, and the attitude of that person drives the kind of decision that is made on behalf of the child. Of course, there are also other external factors that also influence that individual's decision, but that person is at a very important plays a very important role. And for the target of research or target of understanding vaccination decision making is usually looking at those kind of individuals, because they are just everything that has to do with a decision about vaccination. For those that are disabled, and that is where a little bit of more, maybe a little bit of more focus needs to actually go into, because it's a very tricky one. Yes, those people may not may not have the ability, or may be incapable of making those kind of decisions for themselves. But irrespective of the circumstance of those who are recipient of the vaccination, of the vaccination, those making the vaccination decision, those making those decisions for them are they are the how do I put it? They are the most important actors, and once the attitude positive or negative, that also influence the kind of decision they make about those on behalf of those people that cannot make those decisions for themselves. So it is a little bit here and there, not here, not there in many cases, but I think in a broad sense, it just deals with how they perceive vaccination, or how they perceive vaccines, or how they perceive issues surrounding discussions about health of a child and preventive, how either positive their health seeking behavior is, or negative their health seeking behavior is. So those are influencing parameters for which we use to assess whether those ones have they could make good decisions for on behalf of the child or the disabled individual, or bad decision on behalf of the child or the disabled individual. But they are also within that core group that is very important for understanding, because vaccination is most importantly, especially just like I mentioned earlier on about how the contribution is for children under 5, mothers, fathers of children under those age, and of course those for disabled individuals. We have that as a good target group for future and subsequent research to come. So I think it's not a black and white something most times, but it's something that just needs to keep evolving and keep understanding them. And as we understand them, we keep making different intervention options available to help improve how they make those decisions. Because at the end of the day, we want everyone to be vaccinated, and we want these individuals to remain healthy, whether disabled or children. But we want also to reduce the not only the mortality and morbidity associated with some of these diseases, but we want to also maintain a very healthy society. And for that reason, everybody is involved. Those making those decisions, just like I mentioned earlier on, sometimes the factors surrounding those decisions are actually primarily not even lying on those individuals that makes those decisions, but other externalities around them, like families, like environment, like context, like time, like religion, like we mentioned earlier on, like kind of source of information. So all of these are evolving trend and events that eventually culminate into that point where they have to make a decision whether to vaccinate the child or to vaccinate the individual, or to make a decision to vaccinate or not to vaccinate. So we must continue to press in not only on those individuals, but also other contextual factors surrounding how those people make those decisions, and move from there.
Okay, well, if I may recall, you mentioned about mobilization and permission during the government policy on increasing the vaccine participation. But what do you think are the key aspects that have to be considered in planning and delivery? And maybe do you have a suggestions that how the government should do to increase the participation?
Yeah, sure. I think there is a lot that government can do. There is a lot that we all can do. Everybody have a role to play in this case. And for the government, depending on where, of course, COVID-19 exposes a lot of, in fact, I think vaccine hesitancy became a lot more popular during COVID-19. A lot of people didn't know much about vaccine hesitancy, but this has been an issue for a while prior to COVID-19. And I have been researching on this even prior to COVID-19. But at least COVID-19 contextualized this to everyone, and we saw that as very, very evident. So depend on the place, depend on the country, depend on the community, depend on the politics. And so this all put together or come together to affect how government or we all need to drive the idea of participation. We saw how government actors during COVID-19 influence whether or not people take COVID-19 vaccines. We saw what happened in America. We saw what happened in Brazil. We saw in India. We saw a couple of countries that have whose leaders or whose political system have skepticism towards vaccination, and that has its own negative effect on on COVID-19 vaccination uptake in the society in general. We 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 can also translate that to other aspect of vaccination, or other, whether childhood vaccination or adult vaccination generally. So the first is to look at the political system. If the political system have susceptible attitude, or is friendly towards, or is knowledge enough towards towards vaccination as a public health measure that is good for the society. If that is the case, that is in itself we show in terms of policy, in terms of outlook, and in terms of disposition towards encouraging or discouraging participation in vaccination. Another aspect that we've also seen in some of our research have also been that healthcare workers, either either in terms of knowledge or in terms of healthcare workers' attitude, that also have influencing factor on participation. I have done a couple of interviews where several caregivers highlighted attitude of healthcare workers as a discouraging factor for starting vaccination and not completing the dose of the vaccination for their children. And that in itself is not just in one country, it's not just in two countries, it's not in two countries. So it's something that must be looked at as a very problematic thing and must be addressed as this. I think medical ethics surrounding the medical ethics needs to be further reinforced in those settings where especially for communities like those caregivers of children. There needs to be kind of handled in a more careful. Then the interaction with them needs to be a lot more careful. We need to have more empathy and more take them more serious than we currently have. So those kind of things could be something that will include participation. Another thing is also community engagement. I think we've also seen a disconnect between especially in low and middle income countries that's still very conservative and very traditional in culture and some practices. There must be a connect between healthcare workers or the healthcare system itself and community engagement. And these gatekeepers could be religious leaders, traditional leaders, cultural influencing individuals within communities. There has to be a connect between these two because at the end of the day, we need trust both ways for us to have a vaccination uptake. And if this doesn't exist, this will not improve. And for this to exist, there needs to be a further increasing amount of engagement between this group. The other aspect of it also is we need to increase the amount of research also in understanding, especially behavioral aspect of all of this. Prior to now, especially in low and middle income countries, the problem had always been, or the assumption of the problem has always been that there needs to be more hospitals, more clinics. There needs to be more money pumped into the public health system. There needs to be we need to employ more healthcare workers to man different places. But the more some of these structural investments are made, there are no commensurate outcomes in terms of vaccination coverage. Some of them are even stagnated, or some of them are even retrogressing. So the amount of investment made into structural inputs to support vaccination and vaccination demand in low and middle income countries has not been corresponding to the amount put into research on understanding environmental, individual, and contextual behavior surrounding vaccination decision making. So if we can have an increasing amount or increasing proportion of investment in that, I think we'll make a significant progress with respect to participation as we see in government. Also, we could also work on communication, because this is one aspect that is very, very important. It has the ability to cripple the entire progress that has been made over time and also stagnate any progress moving forward. So communicating vaccination is a very delicate thing. Communicating, the healthcare, health communication in general is a very serious business, which has not been taken very seriously in low-income countries. In high-income countries, there's a sophisticated mechanism for health communication, and it's been interdisciplinary, and it's been standardized, and it's been structured, and it's been targeted. But in low and middle income countries, this has not been significantly done. So this is something that I think, if addressed, could improve the amount of participation that we see vaccination uptake in the region. So the communication could also be, of course, being dynamic about the target group, the population, using different mediums. So social media, the traditional media, and also the other systems that are also in place in some of these places. And there's no one system fix all when it comes to communication. Some of the communication are done via some non-conventional means. For example, in the Africa region, if communication are best and better driven when they are in collaboration with cultural and religious groups, it is more effective that way. But that has not been utilized, or that has not been taken advantage of over time. So new communication drive or health communication drive that will be moving forward for driving vaccination uptake in the region needs to incorporate these two broad elements in order to have the adequate amount of result that we hope that it will have. Yeah.
Marvelous. Thanks for all that information, Collins. I think you've really shown vaccine hesitancy to be not as clear cut as probably what a lot of people think. It's very contextual, it's very individualized. So when it comes to policy making in governments, there needs to be a lot of consultation and stakeholder engagement so they can create accurate and appropriate policies here. I know I've learned a lot. I'm sure Ari's learned a lot, and I know our listeners have learned a lot. So thank you so much for your time and sharing your knowledge today, Collins.
Thank you very much for having me, and it's a nice experience being with you guys.
No worries, our pleasure. So I've been Alyssa.
And I'm Ari, and this has been another episode of the Willie Brandt School Bulletin podcast. Thanks for joining us, and see you on the next episode.